This 62-year-old man, whom we will call Livingstone, asked us to hide his identity so he can speak openly about how he's lived with HIV for the past 10 years.
It was during my youthful days that I contracted HIV, and I later got married.
Livingstone is a resident of Butuntumula sub-county in Luweero district. He's known his HIV status for quite a while now, but refused to get treatment. It's only when he fell seriously ill that he was forced to start taking antiretroviral drugs.
It was only after I became seriously ill that I sought treatment.
Statistics from the Ministry of Health indicate that the HIV prevalence in the country is at 7.3%. A recent AIDS indicator survey carried out in Luweero district puts the prevalence rate at 9%.
The fisher folks, because of the nature of the work that they are doing, the NECOs, the NECOs, they are at risk because sometimes they say, sometimes they don't use condoms, by the way. It depends upon the customer who has come to access what? His service. You see, service provider. It depends upon the men who have come. Others, they don't want condoms. Then even the border men.
But the prevalence rates are estimates. The exact number of people living with HIV is likely to be higher, given that most men do not want to get tested. The only way they get to know their status is when they accompany their wives for antenatal care. Livingstone, who found out after tagging along with his wife, narrated his experience.
Most of us men only accept to be tested when we are in critical condition. We fear to be stigmatized.
But even after knowing their status, many men refuse to get treatment until their health deteriorates. Samuel Bahati is another person living with HIV in the central Uganda district. He also kept his status a secret and refused to take ARVs. He eventually accepted and now feels much better after a month of treatment at Luweero Health Center 4.
My condition was very bad. I was coughing a lot and couldn't speak clearly.
Annette Nabirie, a counselor at Luweero Health Center 4, says the facility has 2,522 patients on ARVs. 614 of them are men, 143 children, and 1,765 are women. Nabiria says there are more men who refuse to take drugs compared to women.
These mellow people, they have stigma. They fear to come to the clinic. Most of the biggest percentage fears to come to the clinic. Actually, even those ones who have been able to come to the clinic, in most cases, they end up sending their wives to come and collect medication for them.
But this comes with consequences, the most serious of which is the spread of the virus to others.
A man can have more than 5 wives, and he can move out in one single day and sleeps with over 5 women in one day. In addition to the housewife, he also moves out to other people.
Nabirie calls for more sensitization to fight stigma among men.
We are trying to use all means to encourage men to come to access our service, health education, community dialogues, and counseling.